I will be discussing about the high pressure baroreceptor reflex. Now in our body we are having baroreceptors of two types. One is high pressure, other one is low pressure. Now the low pressure baroreceptor basically found in the wall of your atria and your pulmonary veins. Okay, but in this video I will mainly discuss about the high pressure baroreceptors. So if we look at into the definition goes by a rapidly acting negative feedback neural mechanism that detects the changes in your arterial wall stretch and ultimately regulating your heart rate, your cardiac output and peripheral vascular resistance, which ultimately regulates your arterial blood pressure on a beat to beat basis. Now this last word is very important. Baroreceptor reflex, or I can say high pressure baroreceptor reflex, regulate your arterial blood pressure on beat to beat basis, or I can say in a very short duration. So that's why we call this reflex a buffer reflex. What do you mean by buffer reflex? Let's see. In first graph, we are having normal functioning baroreceptors. So you can see that in 24 hours, the daily, or I can say fluctuation of blood pressure in 24 hours is very minimal as compared to the second graph where baroreceptors are denervated, or I can say baroreceptors are inactivated. In this situation, the 24-hour BP fluctuation is very high. You can see the large spikes of BP. So we can see that without baroreceptor, our BP will fluctuate more as compared to the normal functioning baroreceptor. So we call this reflex a buffer reflex. Why? Because it buffers the acute BP fluctuation in a very short term, or I can say second to minute basis. Now let's look at the baroreceptor structure and the location. Now structure wise, you can see here baroreceptor basically found in the outermost layer of your blood vessel, that is your adventitia. Okay, so in adventitia layer, or the outermost layer of your blood vessel, you are having this baroreceptor, and baroreceptor are basically the spray type nerve ending found in the outermost layer. So these are the baroreceptor. Now the important or interesting thing is that baroreceptors are basically the mechanoreceptors. So these baroreceptors are basically the mechanoreceptors. Now what do you mean by mechanoreceptors? Mechanoreceptor means as you stretch the baroreceptor, as the baroreceptor will get stretched, the baroreceptor will fire. Okay, so when you stretch them more, the baroreceptor will fire more. And how this property will be helpful, we'll see that in in next slide. Okay, now, location-wise, all your major arteries of your head and neck region are having the baroreceptor. But clinically important, we are having two types of baroreceptors. One is carotid baroreceptors and other one is your aortic baroreceptor. Now, the carotid baroreceptor present in the carotid sinus, that is basically the initial dilated part of your internal carotid artery. Okay, so carotid baroreceptor present in the carotid sinus, that is basically this dilated portion of your internal carotid artery, and the aortic baroreceptor present in the aortic arch. Okay, simple. Now this carotid baroreceptor is, now both these baroreceptor are having the some kind of efferent supply. Efferent means the nerve which carries the sensation from this baroreceptor to your brain. So the efferent nerve supply of this carotid baroreceptor is supplied, or is having nerve supply by the cranial nerve 9, where this aortic baroreceptor is having efferent supply from this cranial nerve 10. Okay, if we want to be more specific, then this one branch of this cranial nerve 9 is known as, there is one branch of this cranial nerve 9 is known as Herring's nerve. And now this Herring's nerve is actually the efferent of this carotid baroreceptor. Similarly, if we want to be specific, aortic baroreceptor, the branch of this vagus nerve, or I can say branch of the 10th cranial nerve which supplies this aortic baroreceptor, is known as aortic depressor nerve. Okay. So we now know the location of this baroreceptor and structure of the baroreceptor. Structure wise, important thing here is that these are the mechanoreceptors. So as you stretch them, the baroreceptor will fire more, and as the baroreceptor will stretch less, the firing will be less. Okay, so far so good. Now comes the reflex arc and the response to change in blood pressure. We'll see that simultaneously. So reflex arc I will discuss in this heading. Okay, so let's imagine first situation where my BP is elevated. So the stimulus will be my high blood pressure. Okay, so my BP is elevated. Now as my BP is elevated, now this my blood vessel will be stretched more. Okay, so these are my blood vessel now stretching more. So now all my blood vessel, because of the high blood pressure, is stretching more. Okay, so as blood vessel will be stretched more, there will be a increased stretch in the blood vessel wall. Okay, now what will happen to the baroreceptor firing? We know that baroreceptors are the mechanoreceptors. So as you stretch them more, as my blood vessel is stretching more and more, so what will happen to the baroreceptor present in the wall of the blood vessel? They will fire more. So there will be a more firing of the baroreceptor. So I can say firing frequency of the baroreceptor will increase. Okay, so you can see here that it is the carotid baroreceptor present in the carotid artery, and here are the aortic baroreceptor present in the aortic arch. Okay, now this baroreceptor will be firing more because of the increased stretch, because of the increased blood pressure. Now when this baroreceptor will fire more, the sensation from this baroreceptor will be carried by the, which now we know that cranial nerve 10 will be carrying sensation from the aortic, and the cranial nerve 9 will be carrying the sensation from this carotid baroreceptor. Now both these nerve will carry the sensation to the CNS, but if I want to be more specific, in the CNS which region they carry the sensation, it will be your nucleus of tractus solitarius. Now this nucleus is very important, nucleus of tractus solitarius, because it is the main nucleus, it is the main relay center. But before going to that, let's complete the table. Efferent will be here. If receptors are firing more, the efferent will be our cranial nerve. Okay, efferent will be our cranial nerve 9 and cranial nerve 10. Now comes the part of central processing. Now this is the important part, or I can say the core of this mechanism. So if we want to talk about the central processing, now all the efferent will carry the sensation to which nucleus? We know that it is the nucleus of tractus solitarius, which is the main center. So now the baroreceptor are stimulating more. I can say baroreceptor are firing more and more. Because the firing frequency is increasing, the efferent will this nucleus tractus solitarius stimulation by the efferent now will be increased. So more and more stimulation of the nucleus tractus solitarius happen. Now whenever you stimulate the nucleus tractus solitarius, it will do the two things. First, it will stimulate this deep pressure area. Also, it will stimulate this nucleus ambiguous. We'll see one by one. So whenever I say nucleus of tractus solitarius stimulating these two areas, which means that nucleus of tractus solitarius releasing the neurotransmitter glutamate over this region. Okay, so nucleus of tractus solitarius will be releasing neurotransmitter glutamate over this region and stimulating the nucleus ambiguous and the deep pressure area. Now we'll see the nucleus ambiguous first. When you stimulate the nucleus ambiguous, which means you are stimulating the parasympathetic system. Why? Because this nucleus of ambiguous is the nucleus of your parasympathetic system. So stimulation of nucleus ambiguous means you are stimulating the parasympathetic system. And which nerve carries the parasympathetic efferent? We all know that it is the famous vagus nerve. So from the nucleus ambiguous, we are having this vagus nerve exiting here. So this is the vagus nerve carrying the efferent sensation from the nucleus ambiguous and supplying your SA node, as well as it is supplying your AV node. So whenever you stimulate the nucleus ambiguous, the sensation will be carried by vagus efferent from this nucleus to your heart, the SA node and the AV node. So what are we discussing? We are stimulating the nucleus of tractus solitarius, and the first thing it will do is it will stimulate the nucleus ambiguous. Nucleus ambiguous stimulation means you are stimulating the parasympathetic system. So in the efferent there will be a stimulation of parasympathetic system. Okay, parasympathetic stimulation means you are stimulating the SA node and the AV node by the vagal supply. And whenever you stimulate these two things with the vagus, there will be a decrease in the heart rate. So your heart rate will be decreased. Okay. Now we have covered this nucleus ambiguous. Now we'll see the deep pressure area. Now this deep pressure area also known as CVLM. Okay, the fancy name CVLM means simple name hai. CVLM means caudal ventrolateral medullary nucleus. CVLM means caudal ventrolateral medullary nucleus. Okay, is known as CVLM. Okay. So CVLM, or I can say the deep pressure area, as the name suggests, it is a deep pressure area. So NTS stimulation. So the NTS stimulation, whenever you stimulate this NTS, it will stimulate two things: deep pressure area and nucleus ambiguous. Whenever you stimulate this deep pressure area, what will it do? It will release the neurotransmitter. GABA. It will release the neurotransmitter GABA because it is a deep pressure area. It will act like a brake. It is an inhibitory area. And what is the inhibitory neurotransmitter? It is the GABA. So CVLM, or deep pressure area, will release the GABA over this pressure area. Okay. Now the pressure area, also known as vasomotor center, also known as RVLM. RVLM means रोस्ट्रल वेंट्रोलेटरल मेड्यूलरी न्यूक्लियस. सो यहाँ पे कोडल था, यहाँ पे रोस्ट्रल है. सिंपल. अब नाम में नहीं जाते, पहले उनका काम समझते हैं. तो CVLM ने क्या किया? तो whenever you stimulate the NTS, nucleus of tractus solitarius, it will be stimulating two things: nucleus ambiguous and the CVLM, or I can say the deep pressure area. Stimulation of the deep pressure area will cause the inhibition of the pressure area by releasing the neurotransmitter GABA. प्रेशर एरिया जो है वो है आपके सिंपैथेटिक सिस्टम का न्यूक्लियस. सो व्हेनेवर यू आर inhibiting this pressure area or the vasomotor center, you are inhibiting this sympathetic system. Or whenever I discuss the descending sympathetic efferent, now these are the descending sympathetic efferent fiber. They will go to the spinal cord and come out from the spinal cord, and this sympathetic efferent are also supplying the your vagus nerve. Also it will be supplying your ventricular muscles. Also it will be supplying the blood vessels. Okay, so whenever you are inhibiting the sympathetic system, you are also decreasing the heart rate, by the SA node stimulation, or I can say SA node inhibition. Also you are inhibiting the, also it is supplying the ventricular muscle, so also you are decreasing the cardiac output, and it is also supplying the smooth muscles of the blood vessel, and you are inhibiting this, so there will be a vasodilatation, so there will be decrease in the peripheral vascular resistance also. So all these effect, now what we have done, we are पहले यहाँ पे लिख लेते हैं, इफ्रेंट ने क्या किया, देयर विल बी इनहिबिशन ऑफ सिंपैथेटिक सिस्टम एंड ऑल दिस रिस्पॉन्स, इसका अल्टीमेट रिजल्ट क्या होगा, देयर विल बी अ डिक्रीज इन द ब्लड प्रेशर. So this is the function of the baroreceptor. Our initial stimulation was the increase in the blood pressure, and now our final response is the decreased blood pressure. Okay, so if we talk about the decreased blood pressure situation, like if we talk about whenever blood pressure is decreased, so इसका बिल्कुल opposite होगा, there will be a exact opposite reaction to that. Whenever there is a decreased blood pressure, there will be a decreased stretching of your blood vessel wall, and the firing will be decreased, or I can say firing frequency will be decreased. So there will be a less stimulation. Okay, so there will be a less stimulation of nucleus rectus solitarius, and there will be a less stimulation of nucleus ambiguous. Less stimulation का मतलब है there will be a less stimulation of parasympathetic system. Also nucleus ambiguous also stimulating the pressure area. If the stimulation of nucleus rectus solitarius is less, there will be a less stimulation of deep pressure area, and deep pressure area was inhibiting the pressure area, so there will be a less inhibition of the area. So I can say there will be a disinhibition or less inhibition of pressure area, and there will be a stimulation, or I can say indirect stimulation of sympathetic system, and there will be increase in the heart rate, increase in the cardiac output, and increase in the peripheral resistance, which will ultimately increase your blood pressure. Okay, now we'll see the operating range of baroreceptor. Two, three things I want to highlight here. First, on the x-axis, I have taken the mean arterial blood pressure. It is the blood pressure which is sensed by your baroreceptor. And on the y-axis, I have taken the firing frequency. Okay, firing frequency of baroreceptor. First thing I want to highlight here is that there is something called थ्रेशोल्ड प्रेशर फॉर बैरोरेसेप्टर. देयर इज समथिंग कॉल्ड थ्रेशोल्ड प्रेशर ऑफ बैरोरेसेप्टर एक्टिवेशन. मतलब कि उस प्रेशर पे बैरोरेसेप्टर विल बी एक्टिवेटेड, और उस प्रेशर पे बैरोरेसेप्टर विल फायर. There will be no activation of baroreceptor below that pressure, and this threshold pressure of baroreceptor activation is the 60 millimeter of mercury. Okay, and there is something called saturation pressure for the baroreceptor. Saturation pressure of baroreceptor means beyond that pressure there will be a no increase in the receptor firing. So okay, so saturation pressure for the baroreceptor is 180 millimeter of mercury. Okay, second thing, if you see the graph, the graph is basically sigmoid shape. In the central portion you can see there is a steep portion. Steep portion means that if you trace this particular thing here down, you can get this approx BP around 100 millimeter of mercury of your mean arterial blood pressure, which means that around this pressure you are getting this steep, and region or meaning of this steep means there will be a baroreceptor is highly sensitive to the pressure changes. So means that whenever you change the pressure little bit here, there will be a high response or high baroreceptor firing from, there will be a high firing from the baroreceptors. Okay, so at around 100 millimeter of mercury, 100 millimeter of Hg mean arterial pressure, your baroreceptor is highly sensitive and you are getting this steep. Now I'll discuss something called baroreceptor resetting, which is very simple. If your BP is chronically altered, if your BP is chronically elevated, I can say there will be a gradual shift in the operating range, and yet now your baroreceptor is having new set point, because it will happen after 24 to 48 hours. So whenever your BP is chronically elevated for 24 to 48 hours, there will be a baroreceptor resetting. And what will happen? So conclusion is that in chronic hypertension, the baroreceptor will maintain your elevated blood pressure rather than normalizing it, because of the concept or because of the phenomenon of baroreceptor resetting. जिसके अंदर baroreceptor, there will be a gradual shift in operating range and there will be a new set point of baroreceptor, and this is the reason why baroreceptors are not for long-term BP regulator. Now this is the favorite question of examiner. They will ask you why baroreceptor is not long-term regulator of BP control, or they can ask in chronic hypertension why does the baroreceptor do not I can say the baroreceptor do not correct the elevated blood pressure. So your answer will be there is a concept of baroreceptor resetting, and because of the resetting, baroreceptor maintain that elevated blood pressure rather than normalizing it. Now we'll discuss some applied physiology. First is orthostatic hypotension. The thing is that from supine position, whenever you transition to standing position, there will be a redistribution, or I can say venous pooling of the blood in your lower limb. Approx 300 to 800 ml of blood will be collected into your lower limb. It's called the blood redistribution, or I can say venous pooling. Now what will happen if your blood is collected, or I can say there is a venous pooling in your lower limb? The venous return to the heart will be decreased. Okay, and if your venous return is decreased, then there will be less filling of the heart, or I can say less diastolic filling of the heart. If diastolic filling is less, there will be a less cardiac output from the heart. So particularly speaking, the blood vessels above the heart is having less cardiac output, and because of the less cardiac output, your brain is getting less blood. Okay, and if your brain is getting less, but there is a chance that you might feel dizziness or you might have syncope. But in normal situation, whenever we transition from supine to standing position, we do not feel anything like that we do not feel any dizziness or syncope. Why? Because we are having the normal functioning baroreceptor. So as soon as our BP drop, is because our cardiac output has dropped, the baroreceptor kick in and it will elevate our blood pressure within second. So you do not feel any dizziness or syncope, even though the most of the blood, or I can say 300 to 800 ml of blood is redistributed in your lower limb. But what is orthostatic hypotension? In case of elderly, or in case of diabetic neuropathy, in this we are having the baroreceptor is not functional. If baroreceptor is not functioning, what will happen? There will be a no correction of your blood pressure, and your blood pressure will be dropped whenever you are standing. So patient might feel the dizziness. Okay, so patient might feel the dizziness, or patient might have the syncope. Okay, is known as orthostatic hypertension. Second is carotid sinus massage. So carotid sinus massage basically helpful in treating in supraventricular tachycardia, shown in this ECG lead. So in supraventricular tachycardia, we are having this one special variety is known as reentrant variety. In reentrant variety, in the AV node, basically there will be a reentrant phenomenon. So carotid sinus massage, what it will do, whenever you stimulate this carotid sinus by external massaging, whenever you massage this carotid sinus from externally, so what will happen? There will be a stimulation of this baroreceptor, and whenever you stimulate the baroreceptor, it will stimulate your nucleus of tractus solitarius. And we have seen that nucleus of tractus solitarius stimulation means two things. One is indirect inhibition of sympathetic system, and there will be a direct stimulation of your parasympathetic system. And if parasympathetic system is supplying your SA node and your AV node, so whenever you stimulate the parasympathetic system, there will be also stimulation, parasympathetic vagal stimulation at the AV node also. And whenever you are having the parasympathetic AV nodal stimulation, there will be a AV nodal delay. AV nodal delay means the impulse which are coming from the SA node to the AV node will be held for some more time. So it will be helpful in treating the SA nodal, it will be helpful in reentrant variety of supraventricular tachycardia. Okay, now lastly I want to discuss some recent advances. There is something called baroreceptor activation therapy, BAT. It is basically helpful in treating the treatment resistance hypertension. So whenever we are having some patient that is not responding to our daily routine medication, we go for this something called baroreceptor activation therapy. In this, we place this carotid sinus lead into the carotid baroreceptors, or I can say carotid baroreceptor apparatus, and whenever we stimulate this lead, this lead will stimulate the afferent going from this receptor to the brain, and there will be a stimulation of afferent, and this afferent will stimulate the nucleus tractus solitarius and ultimately upregulate the parasympathetic activity and downregulate the sympathetic activity. So ultimate result will be there will be a decrease in the blood pressure. Okay, so it is the baroreceptor activation therapy. Basically we use for treatment resistance hypertension. We use something called carotid sinus lead to stimulate the baroreceptors, and specifically speaking, it will stimulate the afferent that is taking a sensation from these baroreceptors. So these are my references. I hope you like this video. Thank you very much.